I've had several people send me emails, send me messages about the fact that they want to go to the UK by force, but they are stuck. And don't worry, just relax. I've got you. Hello, everyone. Thank you very much for joining me. This is your one and only Waka Waka Doctor. Always bring you the best gist with respect to moving abroad. You know how we do it on this channel. Everything that has to do with travel, this is where you want to be. I like to always say this, that I'm not an immigration consultant, but I have the experience with respect to travel. I have been to more than 65 countries at the moment, and I've lived and worked in 5 of them. So you would agree that I have the experience to be able to talk to you about moving abroad. At the moment, you can see that my background is a bit different. I'm on holiday, I'm in Zanzibar, but this never stops. I never stop giving you information. I like to also put this out there that I don't have a WhatsApp number, I don't have a Telegram group. Just in case you get a message saying, send me this on WhatsApp, send me this on Telegram, it is not me. The only way to reach Waka Waka Doctor is in the description box of this video. I also want to say that just in case you want to move to several other countries in Europe, there's a book that I wrote about 6 weeks ago. It's titled Move Abroad by Force. And if you want to acquire that book, just check the description box of this video and you'll be able to do so. Today, like every other video that I've made, we're bringing you something fresh, something new, something interesting. It's about the United Kingdom. I've had several people send me emails, send me messages about the fact that they want to go to the UK by force, but they are stuck. They don't know how to do it. They're really confused. And I always tell them, don't worry, just relax. I've got you. I've got you. And just like we do on this channel, you know, it's not Waka Waka Doctor who does the talking. I bring up professionals who have the expertise to teach you how to do it because they are much more knowledgeable than I am in this field. And so it's always better to hear from the horse's mouth directly than just Waka Waka Doctor. So I'm going to bring my guest up so that we don't waste much time. You know, I like to go boom, 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 very direct. Let me bring up my guest as she does her introduction. How are you doing? Good day to you.
Good day, Doctor. Thank you very much for having me once again. My name is Laura and I'm from Grammatorial Education. Grammatorial Education is an educational consultancy. We are certified by the British Council and we also accredited partners to various awarding bodies in the United Kingdom. And as such, we offer qualifications ranging from diplomas in health and social care, adult care, education, and many other diploma courses. We also provide tuition and, support for people that are looking to relocate to the United Kingdom on a sponsorship or a scholarship. These are some of the services that we provide at Grammatorial Education. And once again, I'm here with good news for your followers. I'm here to let them know what's happening within the NHS, within the recruitment sector, and how they can, fulfill their dreams and aspirations to move to the country of their choice. In this case, we'll be talking about the UK.
Fantastic. Thank you very, very much. This video is for those of you who want to move to the UK. Those of you who are stuck, those of you who don't know what to do, those of you who, are finding it extremely difficult to decide how they want to move. And of course, she's got the gist for us. So tell us, what's this news we've been hearing about the UK, healthcare workers, social care workers, and the ease of coming to the UK?
Yes, so right now, I think the internet is going agog with the news of some countries being added to the red list. Zimbabwe, I understand Zambia has been added to the red list, and we've been hearing lots of false information and misinformation, saying countries like Nigeria, Zimbabwe, Ghana have been delisted or blacklisted or red listed. I've heard so many kinds of names they've called it, and that healthcare workers should no longer, apply to the UK from these countries. But I've just come to say that is not true. That is not entirely correct. I'm sure you must have talked about it before. So if you're from any of these countries, we're bringing you good news. You still need to keep applying. What that just means is that you cannot be targeted by a recruiter, a third-party recruiter. So you cannot get a recruitment agency target you or, come and ask you to recruit through them. So I'm going to talk about that because that's where lots of people are making mistakes on Indeed. So when you go on Indeed, most of the time you see an NHS trust recruiting. It's not the direct NHS trust, it's a third party. So when you get a response, people have been getting responses like, we're not taking workers from this country. So it's because you're going through a third party. But in actual fact, we have about 15 NHS trusts that have just been added to the list. They've gotten their sponsorship license and they are recruiting Band 3 healthcare workers directly from those countries. There's no restriction on who can apply directly to these NHS trusts that have been added to the sponsorship list.
That's amazing. That's amazing. Thank you very, very much for that. So tell us about these jobs that are available. These jobs that you're talking about, the healthcare worker jobs, the social care worker jobs, and how Grammatorial will definitely help people who are looking for these jobs.
Okay, thank you so much, Doctor. Let's talk about the jobs first. In the UK, the biggest employer of health and social care workers is the NHS. So if you go on the NHS website, we tell you facts here. You can go and find out for yourself. Go on Track Jobs. It's that easy. You can do it yourself, guys. You don't really need to pay. This is a message Doctor has been, preaching for so long that you can do these things yourself. So you go on Track Jobs. You can leave the link in the description. Track Jobs has hundreds of jobs, if not thousands of jobs. So right now, where Grammatorial comes in, there are thousands of jobs on the NHS website, Track Jobs. It's no use that there is a critical shortage of health and social care workers in the UK. So you can navigate this space yourself, but where does Grammatorial come in? So the NHS are recruiting, but they're not going to recruit just anybody because they have an employment, shortage. They need to recruit qualified staff. It's a regulated industry, it's a regulated sector. So take, for example, you qualify as a doctor in India or in Zimbabwe or in Nigeria. To work as a doctor in the United Kingdom, there are certain exams that you need to take. There are things you need to do before you can get in. So you're going to waste your time. Just keep throwing in your applications without knowing what to do, even though you're qualified in your country. So the same thing applies for nurses and the same thing applies for healthcare assistants and social workers. However, the NHS are not recruiting below Band 3, So when I say Band 3, some people may ask me, what is Band 3? So in the NHS, the pay grades are banded. So they are banded by scale and pay grades. So you go from Band 2, Band 1, 2, 3, 4, 5, 6, 7, 8, and it just goes to consultants and it goes up that way. So healthcare assistants, you have Band 2 healthcare assistants, Band 3 healthcare assistants, and Band 4 nursing associates. So where do you come in now applying for jobs? If you're applying for Band 2 roles, you're not going to be able to get a sponsorship. So although there are lots of Band 2 roles within the NHS, those roles do not qualify for sponsorships. So if you've been applying 10, 15, 20 Band 2 roles, and you're one of those people that are saying, I've been applying for jobs and I keep getting rejections because you're not doing things the proper way. You're not doing things the right way. You're just throwing in your application, but you're not doing it strategically. So in this journey, you have to be very strategic. Now let's look at Band 3 roles. To become a Band 3 healthcare worker, you need experience and you need qualification. So you arrive at Band 3 after you have done your MVQ2, your MVQ3, and you have a number of months or years of experience working as a healthcare assistant. You are promoted to a Band 3 role. So now here is where the real gist is. These 15 NHS trusts, this number of NHS trusts that have recently gotten their sponsorship are looking for Band 3 workers. They're looking for Band 3 healthcare assistants. They're looking for Band 3 midwife assistants, Band 3 radiography assistants, Band 3 medical assistants. So they are looking for lots of assistants that fit into the Band 3 role. And to qualify as a Band 3 worker within the NHS, you need to have your MVQ3, your level 3 diploma, and the experience I just talked about. So now that is where Grammatorial comes in. We are accredited. We are accredited partners with Ofqual regulated bodies in the UK to deliver the level 3 diploma course, both online and in person. So we offer a blended approach. When you come to Grammatorial, we ask you, what are your aims? What are your aspirations? So for example, someone told me she wants to become a dental nurse. So I had to advise her and steer her towards the clinical options. You have the non-clinical options and the clinical options. And right now she's coming up to the end of her course. And her desire, her aim is to progress into dental nursing. So the level 3 or the MVQ3 diploma in health and social care would actually give you that leverage, not just only the theoretical knowledge, but you're immersed in the clinical and the medical aspect of what it takes to work in a hospital setting or become a registered nurse within the UK. So you have all the background, all the regulations, all the, the legislations of working in the health and care sector, which we know it's a very, regulated sector in the UK. It's not something you just dabble into. It's something that you need to be qualified. You need to get the relevant training. And guys, this is the game changer. This is a game changer. This is a game changer. Not everybody wants to come live and share their stories, but I can tell you that since we started this course in October last year, we've started recording testimonies. We started recording lots and lots of success stories of people that have been applying for about a year before they came on the course. And the moment we did our careers week, which is what I'm going to talk about in a second, and they started applying for these roles, these Band 3 roles, these NHS roles. It took, after putting in a few applications and going to these trusts that are recruiting, then you start to see the results. You start to get the calls back for interview. And when you go for the interviews, you are properly equipped. You have the language, you have the understanding, the right terminologies, you have the experience. And tell me, which organization does not want to invest in someone that has invested in themselves? So you need to invest in yourself. You need to bring something to the table. These trusts, these hospitals, these organizations, they need you. They need people. They need workers. They need healthcare workers. They need senior carers. They need Band 3 workers, but they need workers that are qualified, workers that are experienced, and workers that will add value to their organizations. So this is what is happening. These NHS trusts that we've just added, to our list of, recruiters that have gotten their sponsorship, they're looking for you. They want you. What are you going to do about, meeting their requirements and getting your foot in the door?
Fantastic. Thank you very, very much. You can hear her loud and clear. Grammatorial is licensed. They are licensed to train you, to educate you, to certify you, and then link you up with direct recruiters to help you with these jobs in the United Kingdom. The question they're going to ask is, how long does this training take? Is there any age limit, any degree requirement? Talk us through that.
Yes, thank you very much. How long does this training take? Training takes time, but here at Grammatorial, we fast track your training. It's up to you. It's very intensive. It's really intensive because I know lots of you are looking to make this career change, to switch, and you don't have time to waste. So we have spoken to our accrediting partners and said, yes, we know that this course takes 12 years, but our learners are matured learners. They know what they want. They are highly motivated. How can we compress this for them into 6 months maximum. So they have said, yes, you can fast track it for your learners within 6 months, but they must meet the total hours. So we are working with the total hours. So whereas for 1 year, maybe you would have been going twice a week, or you would have been doing a few hours a week, we have compressed that into 6 months, and we've made it very intensive. So if you know that you are willing to put in the work, the hours, and you're willing to do the hard work, then you can come on this ship. But if you know you're not willing to do the hard work, you don't want to study, you don't want to, to do the things that we're going to ask you to do, if you know that you are someone that wants an easy thing, you just want to relax, you want to be spoon-fed, then this may not be the course for you. But we are going to help you, we're going to guide you, we're going to support you. We don't leave you on your own. We literally, support you throughout your journey, from when you register to when you enroll, to coming on the course, to giving you the right, tuition, mentorship, and support, to even coaching you for your job applications, helping you with your CV, assisting you to make sure that you have all the right employability skills, and then putting you in front of the recruiters. So we literally take you all the way, all the way.
Amazing. Thank you very, very much. We'd like to keep this very short and straight to the point so that everybody can get the meat of the gist. How can people reach you, Grammatorial, if they're interested in this? How can they get access to this information? How can they join the training?
Okay, thank you for that. So if you're interested in any of the things we've talked about, maybe you're in a red listed country and you just want to break that barrier, you want to apply yourself, or maybe you don't fancy going through this through all the different routes that exist, and you want to do it yourself with our help, our support. You want to get this qualification, you want to get it done this year. You really want to, commit to this with our support. You can reach us on info@grammatorial.com. You can also reach us on Instagram. It's Grammatorial Education. You can send us a DM, and you can also reach us on Instagram, and I said on email. Those are the 2 ways you can reach us. Those are the 2 major ways we are accepting inquiries for now. So if you know that this is something you want to do, I'll say do it now, because policies are changing every day. Things are changing rapidly. Doctor has been saying it, things are changing. So if this is something you want to do, no matter where you are in the world, there is no barrier. There is no barrier. Distance is not a barrier. So wherever you are, whatever age you are, there is no restriction, whatever your educational background. Some people will say to me, oh, I don't have a science degree, I didn't do science in school. There is no restriction. The only requirements you need is good English, provided you have, a credit at O-level English, your secondary school leaver certificate English, you have a pass in English, then you're most welcome on this course. There are no restrictions. So reach us on info@grammatorial.com. We'll leave the link for you in the description box, or you can reach us via DM. Grammatorial Education is our only Instagram page. That's it, yeah.
Amazing. Thank you very much. Thank you so much. So there you go, guys. If you got stuck at the moment and you want to move to the UK and you're looking for a way out, most people cannot afford to pay the huge tuition fees in the UK, but they want to go to the UK and work. This is your opportunity, and I think you should take advantage of it. Laura from Grammatorial has shared all the information that you require. If you need more, you can reach out to her on Instagram or via the email that we've put on your screen. Thank you very much for watching this video, and I hope you get to it, because the time to act is now. Till I see you again on another video, another episode. This has been Waka Waka Doctor, and I'm signing out. Cheers.
Thank you. Take care. Bye.